Solid knowledge of the psychotherapy method and theoretical framework used and an accurate assessment capability enables a therapist to formulate the most appropriate case formulation and treatment plan. A good plan and process, again, as discussed earlier, ensure that the treatment outcome can be predicted with acceptable accuracy. This is a highly important aspect that considers the cost effectiveness of treatment options, the duration that it takes to achieve the desirable results, and the level of success of the therapy, and the durability of the benefits after treatment has ended. Without an accurate conceptualization and plan, constant monitoring of progress against expectation, and the ability to adapt the program when needed, treatment outcomes, according to research, will not be optimal and may even potentially fail. A poor diagnosis or wrong diagnosis by the appropriate mental health professional, or failure to see changing aspects that influence the treatment decisions by psychotherapists, can have disastrous outcomes for the therapist and client. On a spectrum of, at best, you could make the point that the efforts may be wasted, unnecessary, expenditure made. And at the end of the spectrum, the worst scenario, the client or another life can be put in danger, or the therapist can receive an administrative complaint or claim. Therefore, adequate time and attention have to be invested. You could make a strong case in point by an appropriate mental health professional with assessment and case conceptualization. The therapist also has to make sure they're suitably qualified and experienced to apply the managed chosen methods and techniques. So working in accordance to their remit is something we've sort of spoken before about being really important. Other points as well that are important for the therapist is to be able to be adaptable to change his or her approach and plans according to the client's needs and progress. An accurate assessment hypothesis is required. You could make a case in point to achieve predictable treatment outcome and prevent unintended consequences. So there's some sort of key points. So we can sort of just summarize some of the key points now that we've sort of covered thus far. So some of the objectives of accurate assessment and hypothesis to ensure effective therapy are: it ensures an accurate, but an appropriate mental health professional accurate diagnosis, serves as a basis for the most appropriate case formulation, increases likelihood of an effective treatment plan, and sets a benchmark for monitoring progress, provides a sound justification for clinical and legal decisions, and enables continual adaptation of plan to suit changing client needs and progress.